Good afternoon. My name is Cynthia Graham, Director of Public Relations for the Virgin Islands Department of Education. Today, I am joined by Education Commissioner Raquel Berry Benjamin and Health Commissioner Justa Encarnacion, both of whom will address safety protocols and best practices for keeping school campuses safe during in-person learning. Commissioner Berry Benjamin.
Thank you, Ms. Graham. Good afternoon, Virgin Islands community, and thank you for joining us today. Commissioner Encarnacion and I felt it was important for us to come to you today to address concerns as we seek to educate students safely during the current COVID-19 environment. As you are aware, the department successfully reopened its campuses across the territory for in-person learning on Tuesday, September 7th. We are extremely proud of this accomplishment. We welcomed students in grades pre-K through 3rd, special education self-contained classes, and career and technical education students enrolled in a particular career pathway. The VI Department of Education continues to lead the way in our region and in many cases among our counterparts on the mainland when it comes to reopening schools and keeping students safe while doing so. Last March through May, we successfully opened campuses across the territory to in-person learning. As the Delta variant of COVID-19 continues to impact our local community, it is inevitable that impact would be felt on our in-person operations. The department and its schools have diligently planned for these interruptions to in-person learning. The technology infrastructure that we have put in place over the last year and a half has allowed us to seamlessly move from in-person learning to virtual learning whenever the need arises. This is done with the best interest of students and staff in mind. Yesterday, September 8th, the department made the decision to close 2 of its school campuses to in-person learning: Pearl B. Larson K-8 School on St. Croix and Ola F. Muller Elementary School on St. Thomas. Pearl B. Larson Pre-K-8 School on St. Croix, due to confirmed cases of COVID-19 at the schools. All students at these schools will revert to virtual learning for the remainder of the week. The Department of Education, with guidance and support from the VI Department of Health, has taken great pains to craft COVID-19 protocols for its schools and offices. These protocols have been activated at all schools across the territory. Moving between virtual learning and in-person learning is a part of our COVID-19 protocol. We did this successfully during the last 3 months of the 2020-2021 school year, and we continue to successfully navigate this space whenever necessary. I must say, however, in this health pandemic, the quality of our public education offering is dependent on the quality of the health and vigilance of our community. We must be reminded not to let down our guard against this deadly virus. With the closures of 2 of our schools to in-person learning in one day, the closures of our schools from in-person learning in one day, let this serve as a reminder to continue practicing safety protocols such as wearing a mask, washing hands frequently, sanitizing, socially distancing from others, and most importantly, remaining at home if you're sick. The department wishes to remind employees who are sick to remain at home. If an employee has undergone COVID-19 testing, he or she should remain quarantined until negative COVID test results are received. If an employee tests positive for COVID-19, he or she should seek further guidance from the Department of Health or a healthcare provider. Parents are also informed that if they or anyone in their household tests positive for COVID-19 or have COVID-19 related symptoms, children in that household should not attend in-person classes. All members of the household must remain in quarantine until negative COVID-19 test results are received or until all members have been cleared by the VI Department of Health. To knowingly expose others to COVID-19 is punishable by fines and imprisonment. The COVID-19 vaccine is available to all U.S. VI residents age 12 and up. Visit www.covid19usvi.com/vaccines for more information and to schedule an appointment to receive the free COVID-19 vaccine. Many of our parents want their children in school. This has been observed by the numbers of students that have come to our campuses this week. All of us here at the VI Department of Education want to keep our campuses open. Please help us and help our students. Help us to keep our students and each other safe so that we can continue to provide in-person classes to our vast student population. In closing, I am a firm believer that nothing happens by accident, and everything happens in its time. Employees of the VI Department of Education, we are charged with championing this crisis while securing the education of future generations. I believe we are the right people at the right time to lead our students and families through this challenging time, and ask that you remain encouraged and know that every action you take, large or small, is making a difference. There's only one way through this pandemic, and that is together. Continue to be safe.
Good afternoon, and thank you, Commissioner Barry Benjamin and Ms. Graham. I commend you, Commissioner, along with Assistant Commissioner Sums, who runs your COVID task force, and your leadership team for the education and training done on COVID mitigation efforts that have assisted us in bringing in-person education back. It is critical to the growth of our educational system, our culture, and our being as Virgin Islanders. As time progresses, we will continually see and feel the impact of this pandemic on our population. COVID-19 and the more aggressive Delta variant doesn't discriminate. A total of 732 school-aged children have been afflicted with the disease COVID-19. This count spans the ages of 5 to 18. We have also seen positive cases even younger. Our youngest COVID-positive community member was 1 month old. As Commissioner Barry Benjamin said, we are speaking with you today to provide more guidance for you as parents and caregivers on how to best protect yourselves, your children, teachers, and other people's children from the virus. It is not all about you, but actually it is all about you. Each and every one of us, each and every one of you. How can you make a difference in turning our numbers around? How can you make a difference in the number of hospitalizations and livelihood of healthcare providers and resources needed daily to keep those hospitalized alive? It takes quite a bit. It takes quite a bit of money. It takes quite a bit of time and hard work to continue doing what the healthcare providers do on a day-to-day basis. Dr. Hunt speaks to you on an ongoing basis, and she tells you what she sees when she goes into the hospital. All other states and territories are struggling with the surge of the Delta variant across the nation. So it's not just us. We can make a difference, though. We are the lowest in vaccine rate. The United States Virgin Islands is the lowest in our vaccine rate. However, we are the highest in numbers of positive persons contracting COVID per day, and that is per capita. Our numbers continue to rise every day. And I have to tell you that I cringe when I see a text from Dr. Ellis linked with Dr. Sims, who are also, and you are also familiar with both of them. Today, we diagnosed 80 more positive cases, 50 on St. Croix. Our numbers on St. Croix are definitely going up, 27 on St. Thomas and 3 on St. John. Our active cases territory-wide now is back above 200, it's 215, 142 on St. Croix, 68 on St. Thomas, and 5 on St. John. The virus is spread through the respiratory system, and that is why the wearing of masks is necessary. The virus may last as long as 24 hours on surfaces and less than a few hours if it's in a hot car or in a hot closed space. One mitigation effort that is very easy to remember is, if you're sick, stay home. If you are diagnosed with COVID, stay home. If you are a close contact, and that means your children, if they are living in the same house with you or have been around you for more than 15 minutes without a mask, are also considered close contacts, and they too should stay home. Contact the Department of Health, get tested. Again, stay home while waiting for the test results and when cleared by the Virgin Islands Department of Health. When in doubt, stay home. Call the Department of Health and get tested. The Department of Health continues to provide support and will work hand in hand with the Department of Education and their staff to ensure safe education in school. We will continue to ensure we educate upon mitigation efforts, work hand in hand, re-educate when necessary, but I go back to say, in order for us to be successful, we need your help. And I will end again by always calling the numbers if you're sick, if you feel like you've been exposed to COVID, please call 340-712-6299 or 340-776-1519. And of course, I cannot leave by saying the best mitigation factor for COVID-19 is becoming vaccinated. Community immunity. We are right now less than 50% immunized throughout the territory. We are focusing on 70% immunity to be able to combat the virus. We can only do this with your help. Please call the Vitima hotline at 340-777-8277. 340-777-8277, or visit the website covid19.usvi.care/vaccines. Please help us help you. Thank you.
Thank you, Commissioners. At this time, we will open the line. I see that we have a number of media outlets with us today to ask questions. I'll start with the VI source, Deanna.
Thank you. I don't have any questions at this time. Thank you.
Okay, thank you, Deanna. We'll go to Ernest at VI Consortium.
Yes, hello.
Good afternoon.
Yes, good afternoon. Two questions quickly. Commissioner Encarnacion, obviously the numbers are rising there. Do we have an idea if we're seeing any cases from the Mu variant, or if if you have an idea as to how that is impacting the territory?
Good afternoon, Ernest, and thank you for that question. We actually have been reporting the Mu variant for the last, I think, 2 months. We haven't seen any so far in the month of September. We did see a few in the month of early August. I did ask that question to Dr. Brett Ellis, who is our Director of Laboratories. I have to say that the Mu variant is is not as contagious, so it's not as virulent and strong as the Delta variant right now. More than 90% of our positive cases are within a Delta variant, so not too many of the Mu variant within the recent month.
Okay, thanks, Commissioner. And I guess Two more questions, but I guess this one could go for either the Commissioner of Health or the Department of Education as well. Trying to understand what you are saying in so many words. Is it that you're saying parents and guardians are not being as careful as they should relative to bringing their kids that may be sick to school, and hence leading to the shutdown of facilities? That's what we're seeing?
Yes, that's one of the things we're communicating here today. Yes, thank you for that question. We want to remind parents to remember to do the little things because they matter. Be very vigilant, check temperatures, and of course, if they have a COVID positive within the household, to not send that child or children to school. That's the best precautionary measure we could take in the household, and then of course getting vaccinated is the ultimate precautionary measure at this time.
Okay, I want to follow up quickly before I ask my last question. Then, does the Department of Education has an idea as to when you would see the other classes going to in person? I know you've been using a tiered approach there. Is there a timetable as to when we would see those other classes? Obviously, in-person learning is the best form of learning according to data research over and over. It's a bit concerning that our students are going into 2 years of this virtual situation. Not a fault of the department, just asking a question as to whether you have a timetable when we would see those students returning to in-person learning.
Yes, the timetable is dependent on a number of factors. Obviously, how successful we are with our current students, current student population right now for undergoing in-person learning. Also, the number of COVID positive cases in our community, we want those numbers to go down. We want our vaccination numbers to go up, as Commissioner Encarnacion just expressed. The last thing we want to do is overburden our hospitals and our healthcare workers. So it's a number of factors that play into that timeline. We do have the plan for returning other students, but the timeline is dependent on a variety of factors.
If I may add to that.
All right, thank you.
Ernest,
Yes.
before you go, if I may add to that, right? One of the things that we speak about is the reasons why people take the vaccines, or some of the reasons why individuals don't take the vaccine. And if I can look at parents and those care providers for children who actually attend school, I think this is one of the best reasons to take the vaccine. If you look at what's happening in reference to our educational system, I know that, one, our educational system has provided electronic means of ensuring education is taking place, but not every student is a visual learner. Auditory, yes, but we have to remember that physical contact, that physical learning process is very critical to many of who we are and how we grow and who we become. And I think this is one of the things that nationally people are, what CDC is saying is that if teachers become vaccinated, parents become vaccinated, and the students that are eligible for vaccine become vaccinated, that's one sure way of ensuring that in-school learning actually continues.
All right, Commissioner, thank you. And lastly here for the Commissioner of Education, I think was it last week, you issued a beautiful statement there in regards to the situation of sexual assault regarding that coach in St. Thomas. There are multiple reports now, court documents stating that whistleblowers or those who reported the incident had reported that since 2019. We published your heartfelt statement there, in regards to that situation. Do you know if your higher-ups or if you or anyone had information dating back to 2019 relative to what was going on with Mr. Bruce and the minors?
Thank you, Ernest. This is a very serious matter. The VI Department of Education takes this matter very seriously. The safety and well-being of our students is first priority, and we don't condone any of the allegations that against Mr. Bruce. This is an ongoing investigation at the VI Department of Education. We too are doing our own investigation. So while this investigation is taking place, we prefer not to get ahead of ourselves and wait for the facts to reveal and present themselves accordingly. So just know that we are doing our own investigations as well, based on everything that's presenting itself.
All right, Commissioner, thank you.
All right, thank you, Ernest. At this time, we will go over to Lasiba at the St. Croix Avis.
Hello, good afternoon, everyone. How are we doing today?
Good afternoon. Fine, thank you. And yourself?
Awesome. I just want to continue in that vein for 1 second. Who's conducting that investigation for you in the department?
There are a number of individuals that are tasked with pulling the right persons and asking the right questions. It's not one person, but our legal team clearly is the entity responsible for leading this charge with this investigation, along with our superintendents and other respective individuals.
Awesome, thank you. Many parents have expressed to the AVIS that they are struggling to monitor the flow of online classes, finding out about failed assignments well after the due date and unable to anticipate what's coming next. In some cases because of a lack of a syllabus, and in others because of an unfamiliarity with the online classroom. What resources is the department directing towards parent outreach to help parents that are floundering?
Thank you so much for that question. I'll first like to ask that parents please go on our website and complete our feedback form. That is another option. Your first option is to always inform teachers of your challenges, of course, any successes that you have as well as our principals, so that you can get the immediate support. That's the first line. Contact teachers as well as principals. We also have our parent directors at the districts where we've introduced to you. You've had their support for a number of years. The contact information clearly are the telephone numbers for both districts in our school districts, one in St. Croix, one in the St. Thomas, St. John. And the third layer is that feedback form online. All of our parent offices throughout the territory have a number of support systems to provide to parents, but we don't know if you don't say. Start with the teacher, start with the principal, get to the parent support and utilize that feedback form. It's open to every single Virgin Islander, not just parents, so that we can know your needs and we can address your needs. We do have some parent online support training on the various platforms that we use. If it is based on your question, we need to connect with teachers with the response time. I've noted that, and that's something we will definitely address. But with respect to parental support, we have a number of offerings, programs, and services from both districts, from our parent offices.
Awesome, thank you. And then one thing that both you and the Commissioner of Health encouraged is that if you suspect that your child may have come in contact with a COVID positive, that you keep them at home. If a child is kept at home, are they able to then just turn on the computer and go to that class? Because I would assume the rest of the class is still meeting in person. And then
Yes.
Is that an unexcused absence or?
No, that's a very good question. Yes, the child can log on and attend school virtually. Some parents have chosen to keep their child or children virtually. They will not be required to produce a doctor note. They will be present in class on that day.
Awesome. Thank you. That exhausts
You're
my
welcome.
questions.
Thanks very much, Lasiba. And last but certainly not least, we'll take questions from the Daily News. Is the Daily News on the line? Anyone from the Daily News? Okay, Well, I think that that brings us to the close of today's press conference, and I want to thank everyone for tuning in. Thank you, commissioners, for being here and sharing this important information with the public. And we also encourage parents and the general public to stay abreast of regular updates from the Department of Education by following us, particularly on our Facebook page, and of course tuning in to all of our local media outlets. And also visiting us on our website at vide.vi. And thank you, everyone, and have a good afternoon.